This meeting is being recorded.
All right. So do we have to like state what our group is or anything like that? We just say our names just for the sake of saying them, because I know last time we got in trouble for not saying your name.
Yeah.
Okay, I'm Robbie.
I'm Maura.
I'm AJ.
Oh, sorry.
I'm AJ.
Everybody good?
Yeah, and
I'm
we're talking about provisions 3 of the ANA code.
Okay. So the provision says the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. And this was like a really perfect one to talk about, because I was just having this conversation with my sister the other day, because she texted me and said, so I just got a text message from my manager saying that they want people to come into work because they have nobody to come in. And I don't know what to do because I have to work tomorrow. I don't want to get mandated to stay. She's like, but they're paying us $188 an hour to come into work. And she's like, that's great, but I don't feel safe going to work. She's like, I'm going to go to work. I'm going to get paid all this money, but I'm going to have like 7 patients, and it's not doing what's best for them. It's best for my pocket to go there, but it's not best for them. So she, like, the big topic, I'll read the text message that she said to me. And Sarah, I was sending that text message to you too, like.
Yeah, it's just so insane. Because it sounds like this is happening all over the place too.
So she gave like really, really good advice, I think, which is good to talk about in this, because she said, exactly, she goes, but honestly, it's so bad. I'm over it. I won't work extra for just double time. It has to be more than that because conditions are impossible. I will likely get mandated to work and there's no one else to work. It's a huge risk going in, and we don't understand. We don't know there's so many factors: broken healthcare system, low numbers in the profession, not enough teachers. And then her like big piece of advice was, I would say this is likely to be one of the most dangerous times to enter the profession. Potential for errors, staffing mandation, low morale, and sicker patients. You kind of have to be a badass, but just never forget your job is to take care of the patient. Never let administration dictate that you don't or can't put your patient's safety first. She says you have to almost act like you don't care if they fire you. They will make stupid things seem really important. Chatting with Joint Commission visits, blah, blah, blah. But that's not it. It's all about the patients, and never forget it. So like, it was like a really powerful thing, because it's like, we're coming into this, we have no money, we have so much student debt, and we're going to be put into these situations where we're going to get paid good money, but at what risk?
Right.
So it's like, this provision really like speaks to that.
Yeah, especially like 3.4, nurse must consider patient safety as a major priority. In 3.5, it says the nurse must be aware and willing to express concerns of inappropriate/unethical practice because patient's best interest is priority. So it's like literally what you just said.
And it can be easy to lose that, I feel like, in that, because you want to work, you want to do this, but you want to do the right thing and all that. But and then like there's people like my sister who are just so overworked that they're like, I don't even care if I get paid that much money. Like,
yeah. And I feel like as a new nurse, you might feel obligated because you're kind of like bottom of the totem pole. So like, prove yourself and show that you're a good worker, but I mean, at what cost?
Yeah.
And Robbie, you also spoke about mandated working. So that would be, she would start working and they could threaten her license, correct? If she were to leave?
No, they could just tell her that she can't go home because they don't have anyone who's coming in for the next shift to cover. So like, she could have been there for 12 hours and they don't have anyone to relieve her, and she'd have to stay because they need someone to take care of the patients.
And then if something happens to the patient, that's on her, but she's fatigued, you know? Yikes.
So I feel like that's so hard to hear too as a new nurse, both because a lot of us are like so excited to make money. So like part of that is such an incentive, but then part of it is we like just learned all of these like ethical things and like how to safely administer medication and like how we're supposed to do our job. And then like obviously the real nursing world's different, but I feel like this takes it to like a whole nother level of like how we're gonna learn to be nurses. And like if it's thrown into that kind of environment, that's just like
Yeah.
insane to talk about.
Yeah.
I was
It's
talking about the union stuff too, because like I see stuff online about how union, you have a mandated break, you have only a certain amount of patients you're allowed to see. And I know that there's not always great things with union hospitals, but there's also things that like
Yeah.
they like you have to have a certain amount of patient to
It's like a Brigham, isn't that a union hospital?
I don't know if they are, but I think they might be, yeah.
I
Do
feel like
we
they are
know
because I
that-
feel like they were like the ones that it's really hard to get into that hospital because so many people are part of the union and
Don't leave.
they have patient ratios that like stay the same.
Mhm.
But do we know that that's actually accurate?
From what I've heard.
Yeah, we don't, it's just what you hear, right? You don't know if it's actually true or they're following it.
It'd be cool if it was.
I know.
Can you legally
Then-
not work more than a 16-hour shift? So like even if like say your sister did get mandated to stay those extra 3 hours, like what even happens after that? Like you can't
Yeah, you can't, right?
you legally, like I'm pretty sure it's a state thing, like you can't work more than 16 hours. So it's like I don't know. It's like I feel like I've heard all these conversations about staffing issues, and it's definitely not just at Cape Cod. It's all over the place.
Mhm.
And I mean, I don't know. I'm genuinely curious where all these nurses are kind of disappearing to, because like I know a lot of people left with COVID and everything like that, but you have programs like Northeastern where you have like 70, 80 kids almost every semester just being like thrown out as new grads. It's just like I don't know. I'm genuinely curious how there's so many staffing issues.
That's a really good point.
Mhm.
No
Yeah,
idea.
I
yeah.
mean, it's
Yeah.
because the healthcare system is so broken. Like there's just so many sick people and health insurance sucks and like yeah.
No. I know
Yeah.
that they're losing a lot to like travel nursing, but I know that they've new
That's
grads-
the other thing. She said that they can't like hospitals can't withstand like having their staff being made up of 100% travelers because they can't afford it, first of all. Second of all, they have no skin in the game, basically. Like they can just leave whenever they want. They stay there for a contracted amount of time and then they leave. There's no like loyalty.
Yeah.
So I
It's
think
not
that's
sustainable.
why, hospitals have like upped their new grad, like whatever, what you get when you sign up to
Mhm.
like
Like a
10,000.
sign-on bonus.
Yeah,
Yeah.
sign-on bonus because they want people to stay. But I mean, if people are looking at the money, then
And with the money, like some of those hospitals can provide the hazard pay and like the extra amounts of money, which would make some nurses stay, but not all of the hospitals can afford that. So you have to also think about the hospitals that aren't paying their nurses $180 and that those still have very valid patients. So it's going to exist in all types of hospitals.
yeah,
Mhm.
that's a really tough situation for your sister to be in. Like,
But like what she said in like this provision, like how as the nurse you're supposed to promote and advocate and protect your patient and the safety. It's just how are you supposed to do that? Like if
if you're being mandated to work,
you're being mandated to work and you have so many patients, what are you supposed to
7
do?
patients, that's crazy.
Yeah, Robbie, and that kind of makes me think because at first I was like, obviously she needs to put herself first and like not work so many hours, like out of the safety for the patient, because after a while I figure you're just so fatigued and like stretching yourself so thin. But then I feel like you also have to think about like if I leave, then like who's gonna even like watch the patient at all? So
Yeah.
I feel like that's such an ethical thing right there because it's like, do I like sacrifice my own like safety and well-being for like the patient even if they're not getting like the best care I can give them, or do I like leave and like help myself to give them like no care at all? But then you're also like not responsible if something like bad happens if you're there and like stretching yourself so thin. So I feel like it's just like such a multi-dimensional like issue.
Double-edged
I
sword, yeah.
It's like you almost feel guilty for not staying, and like when
Yeah.
you know you should be leaving yourself.
Mm-hmm.
Yeah.
The one of the little sub points of this provision kind of talks about how nurses must protect patients from harm when practice is impaired. So it's really interesting because the provision talks about like a nurse may become fatigued, they may have an injury, they may have some sort of illness or substance abuse issue, and like we're supposed to be reporting that or like encouraging them to seek help and doing all of those things. But it's interesting because it's also like nurses are putting themselves in danger, like Fran just said. And then like, but we're fatigued, the patients aren't getting taken care of. It's the whole double-edged sword. And I think like reading through this whole code of ethics, a lot of it talks about how we're looking like to our institution, and there are a set of guidelines and there are all these rules. But then it's like, yeah, all of these rules are in practice, but when something's really wrong, are we supposed to then go to the institution that's telling us to work 16 hours straight?
Exactly, yeah.
Like it's so, I mean, that's an ethical dilemma right there, just reading through this code of ethics, I feel
Yeah.
like.
And it's almost like they're making it seem like it's normal. Like, I mean, even being at clinical, like all my instructors, like, oh yeah, I don't take breaks. I don't pee, you don't drink water, you don't eat. Like, why is that normal? Like, why is that
And
like
it's
the norm?
not
And it's
normal.
not
That's the
normal.
problem.
Like,
Is like
yeah. And that
it's
shouldn't be
not supposed to
normal.
be like that.
Yeah. And if they're like making it seem like that's normal, then you're like, as a new grad, you're like, okay, I guess is what, but then you get burnt out, but that's not really how it should be.
Yeah,
So,
and even like the text message that she got, her manager even said, "We are in a suboptimal position."
That's one way to put it.
yeah.
And I am now offering any and all RNs who are willing to pick up some time, double time, plus $250 for 4 hours that you pick up. It's after Labor Day. Come make some Christmas cash. I'll owe you. And I pay my debts. This is an emergency. Help your colleagues. Dig in and let's get this done.
That's not good.
See, and what I don't like about that is the whole help your colleagues, because that's like being guilt tripped into going to help your colleagues, when in reality it's like you should be helping us by hiring more staff or doing anything to get more staff in there.
And I mean, there's probably
Absolutely.
going to be a colleague that doesn't care about anything but the money, unfortunately. So,
Yeah, but maybe one or two. I feel like most people would
Yeah.
not take that. I don't know.
I would hope not.
Well, it puts it back on like AJ was saying, it definitely puts it back on the individual to like help out the company versus giving the company the responsibility of creating a positive work environment where people, feel comfortable not having to do overtime.
Yeah. And I mean, it all comes back to considering the patient safety as a priority. It seems like from that text that your sister got, the hospital is only caring about having, getting the revenue from having all of these patients in the hospital, when maybe they shouldn't be having that many patients. Maybe they should send them somewhere else.
Yeah.
Maybe there isn't anywhere else to go. I don't know, but
Yeah,
It's-
it does seem
having-
like the hospital cares more about like turning over the bed for the next patient.
Yeah, like, but
Sometimes.
that's like to what she said. She says the patients are sicker. She goes, they're not admitting patients with like what they would have 10 years ago for like nausea and diarrhea or whatever. Like
Same
they're
thing with
sending those people
patient care.
home. They're only accepting the super sick patients,
Yeah.
which means that you need good nurses to take care of them.
Yeah. And if they are sicker, then they need
Mhm.
more care, which means you need a lighter patient load because they might have way more.
Yeah,
things.
it's all crazy. Yeah.
Ugh.
Robbie, what
Something,
kind of floor does your sister work on?
She's on an oncology floor,
Okay.
but it's like less oncology these days and lots of med surge.
So, like,
Okay.
mm.
Mhm.
Something that the preceptor that I was, or I don't know if it was preceptor or whoever was in charge with me today at the clinical orientation mentioned was during COVID, there was a lot of telehealth appointments. So folks were having, quick little sessions on the phone and they were like, I'm fine, I'm fine. And then they were good. But now that people are starting to go back into the hospitals and back into doctors, those patients who might tell a doctor I'm fine when they're not actually not okay are now requiring like in-hospital care because
Mhm.
they've put off care for so long. So that might also be why there's such like an increase of patients
Mhm.
in the ratio to nurses that we actually already have.
Yeah.
That's a good point too. I didn't even think about that. It's all very ethical dilemma.
Yes.
Well, I think that'd be a great example to use in our summary writing about this.
Mhm.
Um,
I feel like we covered a decent amount of like the sub points in the provision too.
yeah, I think the only thing we didn't really talk about is like protecting the patient privacy. I mean, not like we didn't like directly talk about it. And in the provision, it was just talking about like how it's more difficult now with like social media being such a big aspect. And like posting patient information when you shouldn't be, and like protecting, HIPAA. So
Yeah, I feel like part of that like also kind of relates to what we've been talking about, because I can only imagine that like as a nurse you just like are like constantly going and like worrying about how many patients you have and like yourself, and like I feel like it's could be so easy to lose sight of like the core of like healthcare, which is like patient privacy. And like that might, I don't know, because obviously we're not like registered nurses yet, but like I can imagine that it's easy to forget the like core things such as that that's like super important to remember.
Yeah, and even just like signing out of Epic when you leave the computer
Yeah.
or whatever computer it is, that's hard enough.
Yeah.
Yeah.
And
Like,
not
if-
going home with like papers with patients' names.
yeah, or complaining to like a nurse you're working with, like in a public area about something, like,
Yeah.
and like
That's true
revealing
too.
information or whatever.
Mm-hmm.
I mean, you see so many social media posts, I mean, like whatever it is, TikTok, Facebook, whatever, with like patients. And I mean, you can't help but wonder, like, you would hope that they gave consent for that, but like,
Mhm.
how many of those they didn't,
Yeah.
Yeah. Well,
Um, and there was stuff about the research study too, which I feel like we kind of all learned about last semester with like, you have to like really directly communicate the information because it's like the patient's choice to participate, and they need to know like what information is being used where, basically.
Yeah. I mean, I think this whole provision sums up that patient safety and just what they want is number one priority, and it should always be like front and center.
Yeah.
And maybe this ethical dilemma that we know about in everyday life is that this is not the case.
Mhm.
Mhm.
And I feel like we really focused on one specific ethical dilemma where it's like short staffing, which obviously is a very big issue. But I mean, was it is it Vanderbilt, that hospital with the nurse
Mhm.
and
Mhm.
the medication
Rhonda.
overrides? Like, I
Rhonda,
mean,
or-
we could transition into that and spend an hour talking about that too. But it's just it seems like there are so many different things that are involved in patient safety. And I mean, the one we chose is a pretty big one, especially right now. But
Mhm.
Yeah, for sure.
Yeah, like just like medication administration and like being diligent and not bypassing things that are popping up on your computer, like to just pay attention.
Yeah.
yeah,
There was an article in the module, I was just like skimming through it. It's about a woman who she was getting the depot shot. She decided she didn't want to have any more children. They actually ended up giving her a flu shot by accident. She didn't consent to the flu shot, got pregnant. The child had some like brain developmental issues, and for religious reasons, she didn't want to go through with an abortion. So it was just talking about how like, they didn't give her the right medication. And then she didn't consent for the flu shot. So then now she was stuck with a choice to, raise this child. And so it was kind of, I didn't read the entire thing, but it was
Sounds
having,
like my nightmare.
Yikes.
yeah, I know. But I was just, it's very interesting. And it's just like goes to show like, how safe, and you have to really take like everything seriously when you're dealing with your patients, and the patient safety
like-
is the number one priority.
Yeah, like reminds me of first semester, like when you go over like all the 5 rights and all that stuff. It's just they beat us into it so much that it's just you almost get annoyed with it. It's like, yeah, I get it. Like I'm gonna give them the right medication, but then you hear about stuff like this, and it's like, okay, you kind of start to understand why they
And
make it
yeah,
rules.
and that goes back to like working too many hours, having too many patients. There's so much room for error. That's like,
Yeah.
it's
Like if you haven't eaten all day, drinking, you've been 12 hours, like you
well,
have
that's like that point that she made about like not paying attention to the background stuff. Like she's like, screw whatever they're the staffing, what are they called?
The Joint
Administration,
Commission?
Joint
management.
Commission. She's like,
Oh yeah.
seriously, she's like, not important. Drinking water is important, so I'm gonna do it. Like there's like all these things like they're gonna talk to you about, like
right.
talking to them. It's not important. If your patient needs something, that's the priority. Like don't let them think. I mean, like at this point, they need you more than you need them.
Yeah.
That's why they're offering ridiculous amounts of money.
Mhm.
So
I don't know how we want to summarize this and to
yeah, do you think we need to continue recording while we type it?
Probably not.
Yeah, I think we're good with
Good
recording.
discussion. All right, I'm gonna stop them.
okay.